All right, good afternoon, everyone. We are coming up on 1 month since Mike Johnson sent his members home. Remember when he acted like the sky was gonna fall if he let pregnant members stay home and vote by proxy? Remember when he was up in arms at the idea of not coming to the office? Well, where is the House GOP now? We've got plenty of moms who are here ready to get to work, and if Republicans would show up for a single day at the office, we've got work to do, and we are running out of time to do it. Hospitals are closing, maternity care deserts are growing, Medicaid is being gutted by $1 trillion. Think about what that means to the American people, and specifically to the people that Mike Johnson represents. Most children in Louisiana are on Medicaid. 64% of births in Louisiana are paid for by Medicaid, and 74% of nursing home residents in Louisiana are also on Medicaid. So this isn't about blue states versus red states. When you defund Medicaid, when you refuse to stop going after the Affordable Care Act, when you choose to hike premiums, all to cut tax cuts for 900 billionaires, it's everyone else who suffers in every single state, in every single zip code. And this is a man-made disaster that will inflict its harshest impacts on women. And it will hurt the very people that Speaker Johnson and his members are supposed to represent. So let's get back to work. Let's stop the cuts. Let's stop the hikes. Let's start prioritizing families over billionaires. That's what women and families deserve. It's what they expect. And it's what the Democratic women of Congress are fighting for. And I thank the Democratic Women's Caucus for bringing us together. I thank all my colleagues for being here and for being so engaged in this fight for the American people. And that includes our next speaker, a champion from the other side of the Capitol, Senator from Minnesota, Amy Klobuchar.
Right. Well, thank you so much to our leader, Catherine Clark, and to all of these incredible women from the House that are here doing their jobs, as women usually do. And I think they had me come over, one, to give you a little report from the Senate, but two, to show the Speaker of the House that even senators can find their way over to the House of Representatives. I know where the door is. I can get there, and I think they can too. I actually went over and visited the House looking for some of the Republican members from around the country, and of course it was just stone cold silence. And in fact, all I found were a bunch of stones, a bunch of marble statues, and I counted and I realized there were more marble statues of deceased leaders in the House of Representatives than there were actual Republican leaders over in the House of Representatives. So I hope that they're going to join us soon, and I'm so excited. Our Congresswoman in waiting over here from Arizona is with us, and we need to get her seated immediately. This is just ridiculous. She's here, and she's not even officially been made a Congresswoman because of what they're up to, and their reluctance to even bring the House together because they're afraid of votes. So I just think I guess I could start by quoting Marjorie Taylor Greene about the weakness, basically, of not bringing people back when so much is on the line. And we know it's on the line. Our constituents are standing on a healthcare cliff. We are going to see the doubling of premiums, and the notices are coming out now week after week after week, or people go on their healthcare websites in their state and they see these outrageous premiums, and these guys won't even come back to do their jobs. Examples from my state, We have a woman in Eagan, a suburb of the Twin Cities, founder of a small business, who is going to pay $450 more per month, a total of $5,400 more next year. A mom with 2 special needs kids who said their health insurance is going up $1,500 a month. A soybean farmer out in western Minnesota, I visited his farm, and he told me that he was in the middle of a perfect storm of ugly. Between the tariffs hitting him, between the input costs hitting him, and between, of course, these health care premiums, he can't afford it. And that's the point of all this. So many of the people that use these plans are small business owners. They're in rural America. They're in red states. In fact, 75% of them are in states that Donald Trump won. So every time someone says, well, why are you doing this? You're just trying to help someone that supports you. And we're like, no, actually, these are a lot about their constituents, and they need to stand up, and they're starting to hear from them. Now, they've been hearing from them for a long time, and behind closed doors, they all say, this is, to me, the ones I've talked to, they know what the right thing to do is. So they need to come to the table, they need to negotiate with us, because this is not a December thing or a January thing. This is a now thing. Thank you.
Thank you, Senator. We'd now like to recognize our Representative Ayanna Presley.
Hey, sisters.
Hi.
Thank you, Chairwoman Leisure Fernandez, and everyone for joining us here this afternoon here at the Capitol, where Democrats continue to fight for the health of families across this nation, while our Republican colleagues are nowhere to be seen. Today marks 2 weeks since this Republican shutdown of the government. 2 weeks. 2 weeks where real people and real lives have been disrupted. Our greatest wealth as a nation is the health of our people. This Republican manufactured government shutdown is wholesale, widespread harm targeted at our most vulnerable neighbors, especially women and children. Babies who will go without, elders who will struggle needlessly. 40% of births in America are Medicaid births, and Republicans stand ready to dismantle Medicaid as we know it. WIC is a lifeline that helps new parents keep their babies fed. Republicans' government shutdown will run down critical funding for that program in a matter of weeks. These are not just numbers. These are real people. Real people in my district, the Massachusetts 7th, and across our country. This is a grandmother in Dorchester who is already skipping meals to pay for prescriptions. This is a young mom in Chelsea who told me she doesn't know how she'll afford her child's asthma inhaler if premiums go up. This is a federal employee in Somerville, furloughed, left without pay, yet eager to get back to their unfinished work, desperate to do so. We stand here today to continue sounding the alarm about the hurt and harm our constituents and their families are feeling across the country. Meanwhile, Speaker Johnson is ignoring his constituents who are begging him for help while he falls in line behind the occupant of the White House's reign of terror and retribution. From his cruel attacks on healthcare or his ongoing mass layoffs, Trump is using the shutdown that he created as an excuse to keep attacking our dedicated federal workforce. The cruelty is truly the point. The first event I held after Republicans shut down the government was an emergency convening in my district to hear directly from labor leaders, advocates, and those delivering essential services to communities in need in Massachusetts and across our country. I asked them in one word to speak to what they were feeling. They said nervous, exhausted, fearful of the uncertainty of tomorrow. To our shared constituents, we stand here today and every day to protect your lives and livelihoods. We demand Republicans reopen the government and address the healthcare crisis they created. And we'll continue fighting to affirm your right not only to survive, but to thrive. Our fight isn't over, and we won't give up on you.
We now want to recognize Fatima We now want to recognize Fatima Gross-Graves. We just had a roundtable to discuss the impacts of women from the healthcare crisis that Republicans created, and we'd like to invite her to the podium to speak.
Thank you. Thank you so much. My name is Fatima Gross-Graves. I lead the National Women's Law Center Action Fund. And I want to begin by thanking you, Congresswoman, for convening this roundtable today. We were able to hear stories from women around this country who will lose their health care. We were able to hear stories about health care doubling and tripling if we do not get a deal. And I want to just say that sometimes people talk about health care and it sounds like some academic thing. It's the ability to get cancer treatment. It's whether or not you have preventative care and can get that mammogram. It's whether or not you can go get your blood pressure checked. These are things that people have gotten accustomed to for their families and for themselves, and it is all on the line. And the fact that you are all here fighting for all of us matters. The fact that you are not on vacation, not sort of off and away, but are here and ready to come up with a deal that ensures that the women in this country can actually have what they need to thrive. That's what we heard at that roundtable. And then the last thing that I just want to say is we have been tracking at the National Women's Law Center Action Fund the number of women who have been caught up in not only the cuts to the federal workforce, but the latest furloughs and additional job losses. And I want to say that women are disproportionately targeted in these cuts. And that means it's not only their wages, that means it's their families' wages and communities that are suffering. So we aren't playing around. Now's the time to get it done. And I just want to extend my deep appreciation for your leadership. This is what leadership looks like. Thank you.
Thank you.
Yes. Hi, Congresswoman Rosa DeLauro from the 3rd District of Connecticut. Such an honor to be here today with my House colleagues and Senate colleagues as we join forces together because what we are dealing with and the crux of what we are all about is a Republican health care crisis, which is going to hit American families hard. Just in a few days, October 20th in Connecticut, the notices are going out. Millions of families will understand that their health care coverage through the Affordable Care Act, those exchanges will get a notification of a skyrocketing premium. Some will double, some will triple. That includes 143,000 people in my state of Connecticut, which is why the Democrats are fighting so hard to extend the current expanded premium subsidies before December 15th. Why? Because the first payment is due on December 15th if you want to have health care on January 1st. So the Speaker says, let's talk about it in December. Maybe it's all right for him to talk about it in December, but it's not all right for the people of this country to do that. They don't have the benefits that he has. People have to pay those premiums. But it is not just the ACA marketplaces that are getting hit. Republicans have cut Medicaid by nearly $1 trillion, the biggest cut to the program in the history of the program. It is forcing states to take on their higher share of the cost. And you know what? I take all of the states. None of them have the money to be able to pick up the slack that's going to be caused by this. And women make up 62% of adult Medicaid enrollees. Nationwide, 41% of all births are covered by Medicaid. That's less funding to support families, and delivery will mean more dangerous pregnancies and less postpartum care for those who need it most. I met with the disability community in my district. A young woman, Brianna, gave birth at 33 weeks. Baby's premature. So many development issues. She became part of a program funded by Medicaid called Birth to 3. They worked with her. They helped her to allow her to be able to teach her son how to crawl and how to walk and be able to start school. That will no longer be there. Birth to 3 will be gone. And the ability for a family to take care of a disabled child. And Medicaid is about children about the disabled,
That's right.
about low-income wage earners, and about seniors. Let's not forget it. President Trump's cuts to Medicaid cause major reductions to home and community-based services, allows individuals who are aging and those who have special needs to receive care at home or in the community and not in an institution. 66% of caregivers are women. The loss of funding for this program will force their families either to seek out more expensive specialized care for their loved ones or simply forego it altogether because they cannot afford it. Think about uncompensated care, and when there is no way for a person to be able to have insurance, but they need help, they need treatment, and they go to the emergency room. That is all uncompensated care. You know, the numbers do not lie. It is a Republican health care crisis. It's a Republican shutdown. It is sowing chaos and uncertainty for families across the country during a cost of living crisis. Biggest issue today in this nation is cost of living. People are living paycheck to paycheck. They can't afford electricity, housing, groceries, and the biggest driver of those costs are health care costs. And this is all the Republicans have done to protect the tax breaks they wanted to give to billionaires. Democrats are ready, willing, and able to sit at the table, ready to negotiate. Our message is clear. Cancel the cuts, lower the cost. Let's save health care for Americans. Thank you.
Vote for that
Reopen
Senate
the
Democrat
government,
bill.
right.
Okay, yes, Lee.
Good afternoon, everyone. I'm Congresswoman Yasamin Ansari. I represent Phoenix, Arizona. As you can see behind us, the capital of the United States might be shut down, but Democratic women are here and ready to work. And Republicans, on the other hand, have entered now their third week of paid vacation. Today, the Democratic Women's Caucus heard from so many inspiring women about what is truly at stake: reproductive freedom, affordable health care, food security, and the right to be represented in Congress. These 9 months of Trump 2.0 have felt like 9 years. And as the youngest woman in Congress, I can tell you plainly, it is women who stand to lose the most. First, our reproductive rights. A judge just ruled that Trump can withhold Medicaid reimbursements from Planned Parenthood, part of Trump's big ugly bill. That decision will cost taxpayers $52 million. 200 clinics will close across the country and lead to more maternal deaths than ever before. That's what Trump's America looks like. Women dying because extremists have cut their care. Next, our access to food. Republican/food aid programs gutting WIC and leaving nearly 7 million women and children struggling to afford groceries while prices skyrocket and billionaires get tax breaks that they do not need. Now, as this Trump shutdown drags on, 41 million Americans could lose SNAP benefits, and 2/3 of those households are led by single mothers. While women are fighting to feed their kids, House Republicans are on vacation. Then, finally, our jobs and our health care. If ACA tax credits vanish, hundreds of rural hospitals across the United States will close. This is a fact. That means layoffs for nurses, midwives, and caregivers, the women who keep this country running. When women lose their jobs, families lose their lifelines. And finally, let's talk about power. Who gets a voice and who's being silenced? Right now, my colleague from my neighboring district in Arizona, Adelita Grijalva, is being blocked from taking her seat. Mike Johnson is silencing 800,000 Arizonans, all to protect Donald Trump's cover-up of the Epstein files. She would be the 218th signature on the discharge petition that would then force Speaker Johnson to put every single one of his members on the record to say whether or not they support Trump's cover-up and protect pedophiles and their enablers, or whether or not they stand with victims and truly support accountability. So here's my message. Speaker Johnson, bring Republicans back to Washington, D.C. This is outrageous. Meet us face to face and do your job. Reopen the government, protect health care, swear in Adelita Grijalva, and release the Epstein files. Enough is enough. Standing with these strong, fearless women behind me, I know we have a fighting chance, and we are not going anywhere. Thank you, and now it is an honor to introduce my colleague, Congresswoman-elect Adelita Grijalva.
Good afternoon, buenas tardes. Thank you so much to the team from the Democratic Women's Caucus for inviting me here today. I'm a mom of 3 children, and when you start to attack the health care of our community, especially women of color, the devastating effects are to the most vulnerable in our communities, our babies and our seniors. And so when you look at what is happening right now in our nation and the cuts that are being proposed, I was on a school board for 20 years. We look at occupational therapy, speech therapy, physical therapy that happens at schools, that's billed to Medicaid. So when we look at, a society and how it should be judged, it should be judged on how it affects and how it takes care of its most vulnerable. The Republican Party is not taking care of business, and who is going to end up hurting are the women and children of this community and of this nation. And so it's deeply frustrating for me. I was elected 22 days ago. Incredibly frustrating because every day that I go without being sworn in, Arizona's 7th district goes without a voice. Our constituencies deserve representation. People are struggling right now. Families, workers, especially women who depend on access to health care, child care, reproductive services, and all of those are being attacked and dismantled by Republicans. This includes millions of women across the country who will be kicked off of Medicaid because of this big, horrible bill, and all of whose premiums are going to double because House Republicans refuse to extend ACA assistance. It includes women and children who depend on WIC, SNAP, and Head Start and are being unnecessarily threatened by this Republican shutdown. It's also frustrating for the women and survivors of Jeffrey Epstein's abuses who are waiting for a day of transparency, accountability, and justice. The truth is, this shutdown didn't need to happen. It's a crisis created by extremist politicians who refuse to negotiate or even return from vacation and refuse to protect American healthcare. The same people who are attacking reproductive freedom, bodily autonomy, who are refusing to swear me in, and they're hiding behind these Epstein files. But also know this, women leaders are standing up and saying enough is enough, ya basta. Together, we'll ensure every person, no matter where they are, where they live, they have access to affordable health care, and I'm excited to join this fight for policies that will protect women, children, and families throughout the nation and in Arizona. Thank you. Muchas gracias.
Muchísimas gracias. I'm Teresa Leger Fernandez, and I have the privilege of being the chair of the Democratic Women's Caucus, which will be 97 women strong, a historic high when we finally get to swear in Adelita Grijalva. And thank you so much. It is women on the Senate and on the House who will get this done. And thank you for the work.
Thank you for your leadership. It's really great. Very good. And thanks for being here, unlike some people.
Oh, I know. And I mean, and you're here. I like the fact that you found your way here. Yeah. Like we've all found our way to D.C. That is the perfect metaphor, is who can find their way to D.C. to do the work for the voters in your district? That is the question we need to be asking, is will they find the courage to listen to the voters in their district and do what's right? And I'm going to tell the story of New Mexico. Right? New Mexico is one of those states that relies heavily on the Affordable Care Act and the tax credits. So in New Mexico, our woman governor, together with our leadership in the House and the Senate, voted on some legislation recently to make sure that we could provide a temporary fix to the expiring Affordable Care Act tax credits, be well, in New Mexico. But we were joined by Republicans in the state legislature. Only 3 senators, Republicans, voted against it. Every other Republican senator was there, voted for it. This is an example of Republicans, especially in rural districts like mine. These are Republicans in rural districts like mine. We overlap, listening to their voters, listening to their constituents, having the courage to show up and listen. And we know that across the country, the Democratic Women's Caucus is listening not just to the voters in our districts, but because we have leaders who don't pay attention to their own voters, that we know that it is our job to fight that every woman in every corner of the country has access to health care and at a price they can afford. And that's what we're talking about with regards to extending those tax credits, the same way they were able to give permanent tax cuts to the wealthy and to the billionaires, to those 700 billionaires. Numbers are always just about that. Think about that. 24 million people are going to be negatively impacted directly by the tax subsidies in order to benefit 700 people. And these are the stories that we keep hearing. Those are the numbers. But what we are hearing and talking about are the stories, some of which you have heard today. And we need to remember that it is women who are the decision makers in their families for health care issues. They're going to have to decide when they get those notices, and they're already getting them in New Mexico. I'm assuming they're getting them in your states. And I'm assuming they're getting them in every one of your states. And that's how you know who is telling you the truth. Because if you are seeing health care premiums out there that are going up, you know what the truth is. You live that truth. And we are here fighting for your truth. Because those women will have to make the decision, do I pay my rent? Do I pay for groceries? Or do I pay for my medicine or my health insurance premium? And what we want to do is make sure that that decision is not fatal for those children and for those women. Thank you very much for being here today, and if there are any questions, we'll take them.
Well, people have been pretty out front about saying this is something we want to talk to, we care about health care, we know there's a lot of people in our districts, and behind closed doors are even more clear about that, that they agree with us that you don't want to have these health care premiums double in just a month and do nothing about it when in so many of their constituents, particularly some of these red states, which are increasingly going purple, I'll footnote, that didn't take the Medicaid expansion, so they rely very much on these state plans under the Affordable Care Act. So it is the problem we have is that now that Donald Trump has returned from his successful trip to the Mideast, now that he's back, he prides himself in the art of the deal, and it's time for him to make a deal. I don't believe they on their own, no matter how well-intentioned some of my Republican colleagues, and I am friends with many of them, are, that they on their own, or these House members on their own that won't even come into work because they don't want to vote on the Epstein files, that they are going to on their own come to the table. Donald Trump is going to have to call in the leaders and make an agreement, and I would suggest that today is a really good day to start doing it. Okay, I'm going to go now.
Thank you, Senator. Thank you. Thank you very much.
Senator.